All right, it's already happening. RSV cases are on the rise in early this year.
Yeah, emergency rooms are seeing an increase of patients. Professor and Chair of Primary Care at Kansas University, Dr. Gautam Desai, is with us once again to talk about RSV. Dr. Desai, great to see you again. Thanks for coming back.
Nice to see you gentlemen again.
Let's talk about this here. What is RSV?
Well, even though many of us have not heard of it, most of us had had it by the time we turned 2. So it stands for Respiratory syncytial virus. And it's a virus that plagues a lot of people, and those that are the most vulnerable are the ones that don't do well with it.
And it seems like last year, if people hadn't heard of it, they did hear about it last year. Right around this time, it seemed like you know, Abby and anybody who had kids like under 10, it was, if it wasn't one, it was the other. It was just like this nonstop loop.
It's always something. You know, you got COVID, you got the flu, you got RSV, just a lot of stuff circulating around.
So do symptoms present themselves different in RSV cases, Dr. Desai?
You know, sometimes it's hard to tell the difference because if you're an older child or an adult, you just have a runny, stuffy nose, your throat might hurt for a few days, maybe a cough. But if you're a young child or an older adult, and if it gets in your lungs and causes inflammation, you can start wheezing, having trouble breathing, or start breathing rapidly. So just you can go downhill if you get it really bad.
But the other thing I remember from last fall, Dr. Desai, was, you know, RSV, it seemed to me, was just something you had to worry little kids. But then we were hearing about a lot of adult cases last year. Is that new, and is that still a threat?
It's still a threat because some adults have compromised lungs or hearts. So every year, about 180,000 adults are hospitalized for RSV, and about 14,000 die from it or complications of it.
Jeez.
Well, so if we're watching our little ones and they are struggling with symptoms, and we're trying to decide, do I go to the hospital? Should I try a home treatment? What's your recommendation?
You know, we want to see you. There's nothing worse than being the parent of a child who sees someone like, oh, let's wait it out, let's wait it out. You wait, and then things can go bad. So especially if their lips are turning blue, skin's turning blue, wheezing, or if you see the muscles and bones in the neck and chest, if they're kind of straining.
Struggling just to breathe?
Yeah, then definitely please come in.
And there is a vaccine, obviously, right?
There's a vaccine. If you can get it is a different question. So this year, their manufacturer underestimated how popular it would be. So there is a vaccine for moms who are expecting to deliver, so that around 32 weeks right now, mom can get a vaccine which protects the kid. Children who are born can get some immune globulin to help boost their antibodies. And then older adults can get a vaccine. If you're older than 60, the CDC recommends you talk to a provider, but the trouble is finding it.
So will that improve? Are you hearing that that will improve soon, or will it take next season?
You know, I bet it will improve soon. It's not a problem with anything in the supply chain. It's just the demand was overwhelming.
All right, good stuff. So if people had more questions, where can they find you, Dr. Desai?
Well, we are Trinity Gopper Family Medicine Center, or they can call their pediatrician.
All right.
Always good stuff. Thank you, Dr. Desai.
Thank you both.
Yeah, appreciate it.